78-year-old barber Vincent Chen, who cut hair at Sunset Haven Nursing Home, was just a kind man who trimmed elderly residents' hair for everyone. He would come 3 times a week, quietly do his work, and leave. Until 89-year-old Thomas had a heart attack that Thursday afternoon. While panicked nurses called 911, Vincent put down his scissors, and what he did left everyone stunned. Because no one knew that he was a field medic in the Korean War and a field surgeon in Vietnam, saving thousands of soldiers' lives. Welcome to Stories Between Us. Before we begin this touching story, please tell us in the comments what city you're watching from today. And if you believe unforgettable stories like this deserve to be heard, hit that subscribe button to help keep these stories alive. Sunset Haven Care Center, located in a peaceful neighborhood of Los Angeles, was home to 150 elderly residents. In the 3-story white building, dozens of life stories had been housed since its opening. Retired teachers, former factory workers, war veterans, housewives, all were spending the final chapters of their lives here. Every Tuesday, Thursday, and Saturday at 2 p.m., Vincent Chen would enter the nursing home's doors with his small black bag. At 78 years old, 5 feet 8 inches tall, with silver hair and brown eyes, he presented a calm appearance. He dressed modestly but carefully in his old blue checkered shirt, black pants, and always shiny black shoes. Everyone who knew Vincent would describe him as someone who valued neatness. In his bag were barber scissors, a razor, brushes, and a bottle of pleasant-smelling cologne. He would do his work meticulously, showing the same care and respect for every resident. He never rushed, never acted rudely, never complained. The staff called Vincent Chen the Barber. He was known as quiet, reliable, someone who never caused problems. The elderly loved him because he spoke gently with them and told stories about his former work. But Vincent never talked about his own past. Nurses and doctors didn't always notice Vincent's presence. To them, he was just a barber who came 3 times a week. He didn't interfere with their medical decisions, nor did he step into the healthcare personnel area. He would just cut hair, give shaves, chat with the elderly, and leave. That Thursday, everything was as usual. Vincent had arrived at 2 p.m., signed his name at reception, and gone up to the 2nd floor. His first customer was 84-year-old Harold Chen. His hair had grown very long, and he needed a shave. While Vincent got to work, Harold was telling him, "Vincent, my grandson is coming today. I want to look good." "Of course, Mr. Chen, you'll make him proud." This ordinary conversation was just minutes before the moment that would change their lives. Afternoon hours at Sunset Haven were usually quiet. Most residents were taking their afternoon naps or sitting in the television room. Nurses had completed medication distribution, and doctors had finished their rounds. Vincent had also finished Harold's hair and moved on to the next waiting resident. 89-year-old Thomas Kellaway was one of Vincent's longest-standing customers. He had been using Vincent's barber services for 3 years. A retired accountant, Thomas always loved to look neat and clean. After his wife Margaret died, he had moved to Sunset Haven and lived a quiet but respectable life here. "Vincent, I feel a bit tired today," Thomas said as he sat in the barber chair. "Is that so, Mr. Kellaway? Maybe we should do a quick shave today." No, I want a full shave. I want to look good when I look at Margaret's photo." Vincent smiled. Thomas's love for Margaret was something everyone knew. Every morning he would talk to his wife's photo, telling her about his daily life. Vincent was chatting with Thomas while preparing the shaving foam. It was a normal Thursday afternoon, normal barber service. Nothing suggested anything dramatic would happen. Just then, Thomas suddenly leaned forward in his chair. "Vincent, I can't breathe." Vincent stopped the brush in his hand. Thomas's color had turned gray. Beads of sweat had appeared on his forehead. "Mr. Kellaway, how do you feel?" "Pain in my chest?" Thomas's voice had weakened. At that moment, Vincent Chen wasn't a barber. Decades of medical training kicked in. Thomas's symptoms were very familiar. Acute myocardial infarction. Heart attack. Vincent immediately took action. Vincent gently lowered Thomas from the barber chair to the floor. He checked the old man's pulse. It was weak and irregular. His breathing had become difficult, and his consciousness was beginning to blur. "Help, doctor!" Vincent shouted, but at the same time he had begun applying his own hands-on procedures. Nurse Linda Rodriguez came running. "What happened?" "Mr. Kellaway is having a heart attack. Call 911 immediately and get the defibrillator." Linda was surprised. Vincent's tone of voice had completely changed. He was no longer speaking like a modest barber, but like a medical authority. Are you sure?" "Call them." The certainty in Vincent's voice moved Linda into action. Vincent placed his hands on Thomas's chest and began CPR. But this wasn't ordinary CPR. Vincent's technique was perfect. Precise chest compressions, correct rhythm, correct depth, as if he had done this thousands of times. 30 compressions, 2 breaths, Vincent murmured to himself. "Come on, Thomas, stay with me." Meanwhile, other staff had also gathered. Dr. Anderson came running. "What's the situation?" the doctor asked. 89-year-old male patient, acute myocardial infarction, in arrest for 5 minutes. Started CPR, pulse weak. Vincent gave his report as if he were an ER doctor. Dr. Anderson looked at Vincent in amazement. Where was this terminology, this professionalism coming from? Did you study medicine?" Vincent continued CPR without stopping as he answered. "Field medic in Korea, field surgeon in Vietnam, 50 years of experience." Everyone was frozen. The quiet barber was a war surgeon. As Vincent's hands worked on Thomas's chest, memories from 50 years ago came alive in his mind. Korean War, 1951. 21-year-old young medic Vincent Chen was trying to stabilize wounded soldiers during the Chinese offensive, a cold, muddy battlefield where death was everywhere. Then Vietnam, 1967. 37-year-old experienced field surgeon Vincent Chen was performing 15 to 20 operations a day at the Mobile Army Surgical Hospital. Shrapnel wounds, gunshot injuries, cardiac arrests. He had seen them all, intervened in all of them. "Pulse is coming back," said Dr. Anderson while preparing the defibrillator. Vincent smiled. "Good. Thomas, come back to us." Until the ambulance arrived, Vincent managed to stabilize Thomas's vital signs. The old man had regained consciousness and his breathing had regulated. "Margaret," Thomas whispered. "She's waiting for you," Vincent said softly. "But not today. You're going to be fine." When the paramedics arrived, Vincent gave them a complete briefing. Patient history, intervention timeline, current vitals. One of the paramedics turned to Vincent. "Sir, are you a doctor?" "Retired field surgeon, Korean and Vietnam Wars." "Thank you, sir. You saved his life." Vincent nodded. "Just doing what I was trained to do." After Thomas was loaded into the ambulance, there was complete silence at Sunset Haven. Staff, residents, visitors, everyone was looking at Vincent, but he was just packing his bag as if nothing had happened. "Vincent," said Dr. Anderson, "we knew you were—" "A barber?" Vincent smiled. "But this is also me, doctor." When Vincent returned home that evening, he opened the door of a closet he hadn't opened in a long time. Inside were old uniforms, medals, and photographs. Korean Service Medal, Vietnam Service Medal, Bronze Star, Purple Heart. Witnesses to 50 years of silence. The phone rang. It was Dr. Anderson. "Vincent, Thomas is stable. He'll have quadruple bypass surgery, but he'll be fine, thanks to your intervention." "Happy to help, doctor." "Vincent, can I ask you something? Why didn't you ever tell us you were a surgeon?" Vincent remained silent for a long time. "Doctor, war leaves marks. When I came back from Vietnam, I decided I wanted to help people in peaceful ways. Hair cutting, friendly conversation, simple kindness. But your skills—" "My skills never left. They just waited for the right moment." When Vincent went to Sunset Haven the next day, his reception was very different. Residents stood and applauded. Staff greeted him with respect. But Vincent was, as always, modest, kind, focused on his work. Harold Chen smiled when he saw him. "Vincent, you're a hero." "No, Mr. Chen, I'm just a barber who knows a little first aid." But everyone knew the truth now. Vincent Chen wasn't just a barber. Thomas's surgery was successful, and 3 days later, Vincent visited him. In the hospital, the old man looked at his barber with gratitude. "Vincent, you saved my life." "Thomas, I just did what anyone would do." "No, Vincent, what you did required training, experience, courage. Tell me about your wars." Vincent hesitated. Stories he hadn't told anyone for 50 years. "Korean War started when I was 20, Vincent began slowly. "I was just a kid from San Francisco, Chinatown. Wanted to serve my country." "What did you do there?" "Field medic, front lines. We saved soldiers under enemy fire, performed surgery in tents, worked 20-hour shifts, lost a lot of good men." Thomas listened, his eyes fixed on the old barber. "Then Vietnam?" "Vietnam was different, more intense, more complex. I was older, more experienced. Field surgeon at MASH units. Sometimes we operated while rockets were falling around us." "That must have been traumatic." Vincent nodded. "War changes you, Thomas. You see the worst of humanity, but also the best. Men dying for each other, risking everything to save a friend." "Why did you become a barber after all that?" Vincent smiled. "Because after seeing so much death, I wanted to be around life. Simple, peaceful life. Elderly people remind me of my parents, my grandparents. They deserve dignity, care, kindness." "And cutting hair gives you that?" "Cutting hair allows me to serve without violence, to help people feel good about themselves, to listen to their stories. War taught me to save lives. Peace taught me to enrich lives." Vincent's story spread quickly at Sunset Haven. When families learned who Vincent was, they were shocked. Margaret Peterson's daughter Sarah approached Vincent. "Mr. Chen, my mother has been getting her hair cut by you for 2 years. None of us knew you were a war hero." "I'm not a hero, Miss Peterson, just someone who did his job." "But you served in 2 wars, saved thousands of lives." "And now I cut hair. Both are service, both are important." The staff's attitude had also changed. Dr. Anderson began consulting Vincent for medical consults. Nurses valued his advice, but Vincent never took on the doctor role, he just shared his experience. "Vincent," said Nurse Linda, "maybe you should consider working here as a medical consultant." "Thank you, Linda, but I'm happy being a barber. This way, I can help both body and soul." Some of the new residents began specifically requesting Vincent. 88-year-old Peter Kim, a Korean War veteran, spoke with Vincent in Korean. Hyungnim, older brother, you understand what we went through." "Nay, yes, Peter, we carry those memories together." These connections were very meaningful for Vincent. He was no longer just a barber, but also a therapy provider. Vincent's story also spilled outside of Sunset Haven. Local high school students wanted to interview Vincent for a history project. 17-year-old Emma Rodriguez was researching the Vietnam War. "Mr. Chen, can you tell me what Vietnam was really like?" Vincent thought. How could he tell young people the reality of war? "Emma, war is not like movies. It's fear, confusion, young men dying far from home. But it's also brotherhood, sacrifice, finding humanity in inhumane situations." "Did you ever regret going?" "I regretted the war, but not serving. My job was to heal, to save lives. That gave meaning to senseless conflict." "What would you tell young people today?" "Serve your community. Help others. You don't need war to be a hero. Every act of kindness is heroic." Emma's eyes filled with tears. "Mr. Chen, you're inspiring." "Emma, if my story inspires you to help others, then sharing it was worth it." After these conversations, Vincent began giving monthly talks at Sunset Haven. Not war stories, but talks about service and compassion. Vincent's medical expertise turned into informal consultation service at Sunset Haven. Dr. Anderson regularly discussed challenging cases with Vincent. Vincent, Mrs. Patterson's symptoms aren't classic. Your field experience might give us insight. Doctor, field medicine teaches you to think outside textbooks. Sometimes the obvious answer is wrong. Vincent's suggestions often proved valuable. That perspective, gained from decades of battlefield medicine, was different from clinical. Vincent, Dr. Anderson said one day, have you ever considered teaching? Medical schools would benefit from your experience. Doctor, I teach every day. I teach patience to young nurses. I teach dignity to elderly patients. Teaching doesn't require a classroom. But Vincent accepted the informal mentor role. When young medical residents came to Sunset Haven, Vincent would talk with them. Medicine is not just about diagnosis and treatment. It's about human connection, about seeing the person inside the patient. Thomas stayed in the hospital for 2 weeks, and when he returned to Sunset Haven, Vincent was waiting for him. Vincent, my friend, I owe you my life. Thomas, you owe me nothing, but if you want to repay, live fully. How can I do that at 89? Vincent smiled. Tell your stories, share your wisdom. Every day is a gift, especially at our age. Thomas took this advice seriously. He started storytelling sessions at Sunset Haven, sharing experiences with young visitors. Vincent's inspiration had become infectious. Vincent, you changed not just my life, but how I see life. Thomas, I just reminded you that life is precious. You always knew that. This conversation was a turning point for Vincent. He was no longer just a barber and informal medic, but also a life coach. A year later, Sunset Haven Care Center organized a special recognition ceremony for Vincent Chen. Family members, staff, residents, everyone was there. Vincent, said Facility Director Margaret Torres, you've shown us that heroism comes in many forms. Thank you for your service, both in war and in peace. Vincent approached the microphone, but his speech was short and humble. Thank you for this honor, but real honor belongs to my fallen comrades, to families who lost loved ones, to everyone who serves others quietly, every day. I came here to cut hair. I found a family. War taught me to save lives. Peace taught me to enrich lives. Both are sacred duties. As the applause continued, Vincent added, service never retires. It just finds new forms. That evening at home, Vincent was looking at his old photographs. Young medic Vincent from the Korean War, experienced surgeon Vincent from Vietnam, and now peaceful barber Vincent from Sunset Haven. The same person in every condition, different chapters. Service had always remained at the core. Today, Vincent Chen still comes to Sunset Haven Care Center. He still cuts hair, gives shaves, chats with residents. But now he's also a medical consultant, mentor, and source of inspiration. Thomas Kellaway completely recovered and became one of Vincent's closest friends. They spend time together every week, sharing stories. Vincent, do you ever miss being a surgeon? Thomas, I never stopped being a surgeon. I just operate on hearts now instead of bodies. Vincent's influence extended beyond Sunset Haven. Students from local medical schools come to visit him. Veteran organizations invite him for speeches. But Vincent always gives priority to Sunset Haven. This is my mission field now, he says. Every haircut is a chance to serve. Every conversation is a chance to heal. Vincent now has his own corner at Sunset Haven. Next to the barber chair are military photos, medals, and inspirational quotes. But the most important decoration is the thank you cards from residents. Vincent Chen's story shows a simple truth. Real heroes don't retire, they just find new ways to serve. Sometimes the most powerful stories are lived in the quietest corners, in nursing homes, in barber chairs, in the ordinariness of daily life. People like Vincent Chen live among us, carrying great stories in their past, but content with humble service today. Their stories teach us that heroism is not a moment, but a way of life. From battlefield to barber chair, from field surgery to hair cutting, service is sacred in every form. Vincent's hands trembled when they first touched a wounded soldier in the Korean War. They became steady surgeons' hands in Vietnam. Today, they are gentle barbers' hands. but they have always been healing hands. Do you know someone like this? Someone who looks ordinary but has an extraordinary past? Someone who serves quietly, living humbly? Share with us in the comments, and if this story touched you, like and subscribe. Because stories like this deserve to be heard, these quiet heroes deserve to be honored. With love from Stories Between Us.